Okay, let's unpack this.
Mhm.
Um, Imagine walking into your home and finding your pet, your usually bright, bouncy companion, just unresponsive,
Yeah, limp.
not reacting when you call their name, maybe not even when you touch them. It's got to be one of the most terrifying moments for any pet owner.
Absolutely terrifying. And these states, these really severe unresponsive states, what vets call stupor and coma, they signal something's profoundly wrong. It demands immediate action.
It really does.
Mm.
These conditions mean there's some major dysfunction happening,
Okay.
right? Often hitting the brain directly or indirectly.
That's right. And the material we're digging into today makes it super clear you have to investigate right away to figure out what's going on underneath.
Exactly. And, well, that's our mission for this deep dive, really tailored for you, pulling out the key stuff from these veterinary sources. We're going to try and cut through the medical jargon, understand what stupor and coma really mean for vets, touch on the brain science, why they happen, figure out the crucial clues a vet looks for.
Dive into that surprisingly long list of what could be causing it, understand their diagnostic plan, and, talk a bit about treatment and what the outlook might be.
Think of it as your essential guide. Hopefully you never need it, but if you do, you'll have a better understanding of this kind of emergency.
Yeah, exactly. So we'll start with the definitions, then get into the brain stuff, look at the practical science, and then walk through how vets actually diagnose and manage these cases.
Sounds like a plan.
Okay, so let's jump right in with those definitions. Because they sound similar, stupor and coma, but there's a really critical difference, isn't there? What exactly is stupor?
Well, stupor is a state where, yes, the animal is unconscious,
Hmm.
but, and this is the key thing, you can still get some kind of reaction out of them. It takes a lot of effort, though, like
Yeah.
strong, sometimes even painful stimuli, a hard pinch, or rubbing their chest bone really vigorously.
Oh,
They might, groan, maybe pull a leg back or twitch, but they don't actually wake up, they don't regain real awareness, and they lapse right back when you stop stimulating them.
right. So you get a flicker, like a brief reflex, but no real interaction that lasts. And then coma, that's even more severe.
Coma is, well, it's the most profound state. The animal is completely unconscious, and the critical point is they cannot be aroused at all. No amount of stimulation, no matter how strong you make it, gets any response whatsoever. There's just zero evidence of awareness or interaction.
Okay, so stupor is like being really deeply knocked out, but there's still a tiny spark, a reflex possible. Coma is just lights out completely.
No.
The sources also mention obtunded, right? Which is less severe. Again, that's more like dullness, slow responses, but they can still be woken up by something fairly simple, like calling their name or a gentle touch.
Exactly. It helps frame that whole spectrum, doesn't it? That gradient of altered consciousness.
It really does. Now, what's truly fascinating, I think, is understanding why this happens. Why does an animal become stuporous or comatose? It seems to boil down to the brain's arousal system.
It absolutely does. There's this really critical network of neurons deep down in the brainstem. It's called the ascending reticular activating system, or ARIS for short.
ARIS, okay.
Think of the ARI as like the master switch for consciousness. It's constantly sending signals up to the cerebral cortex, the thinking, aware part of the brain, basically telling it to stay awake and pay attention.
Okay, so ARIS is the key wakefulness system. So if something messes with that switch.
Exactly. Any significant problem, whether it's physical damage directly hitting the brainstem, what we call an anatomic lesion, or a big chemical imbalance affecting the whole body, a metabolic issue if it damages the ARIS itself, or if it causes severe widespread problems across the whole cerebral cortex, that's when you see consciousness start to decline. It can go from just being dull or obtunded down into stupor, and then, in the worst cases, into coma. It could be one specific thing pressing on the brainstem or something affecting the entire brain more generally.
That connection is so important, and the sources really stress that this isn't just about problems starting in the brain itself. They point out that serious issues in other parts of the body can have a massive impact on brain function, right?
Oh, absolutely.
Yeah.
This is a really crucial takeaway. You might immediately think of brain trauma or a tumor, and those are definitely possibilities.
Sure.
But they're far from the only ones. Think about severe metabolic problems from organ failure, like the liver not clearing toxins or the kidneys failing, or lack of oxygen getting to the brain, or overwhelming infection spreading through the body, sepsis, even really severe electrolyte imbalances. All of these systemic problems can disrupt the brain's normal environment so badly that the ARIS and the cortex just can't function properly, leading to stupor or coma.
Wow. I know. Okay, when a pet comes in like this, what's the very first thing the vet's trying to figure out? I imagine the history, what happened leading up to this, must be hugely important.
History is absolutely paramount.
Yeah.
Yeah. The sources really highlight asking about any potential trauma. Could they have been hit by a car? Did they fall from somewhere high?
Right.
Did they get into anything they shouldn't have? Were they unsupervised near chemicals or medications or even garbage?
Hmm.
And what about existing medical issues? Do they have diabetes? Known kidney or liver problems? A history of seizures, maybe? Or even previous episodes of collapsing or breathing difficulties?
Even things like recent medications they've been given, right? Or potential toxin exposure. Antifreeze is a big one, isn't it? Or drugs.
Definitely. Or environmental things where they left out in extreme heat or cold. And crucially, was the onset sudden like flipping a switch? Or was it more gradual, over hours or days? All those historical clues start to build a possible picture.
And then comes the physical exam. Obviously, they'll look for signs of trauma. But beyond that, what else are they focusing on?
They're doing a really thorough head-to-tail exam, specifically hunting for signs of those systemic problems we just talked about. Is the animal's body temperature dangerously high or low? Are their gums really pale, suggesting maybe anemia or poor circulation? Or are they bluish, indicating a lack of oxygen?
Okay.
Are there any signs of bruising? Or those tiny little pinpoint red spots on the skin or gums that could point towards a bleeding disorder? Are there obvious signs of severe heart or lung disease when they listen with a stethoscope?
And you mentioned the eyes can be revealing too.
Yes, they pay close attention to the eyes. Changes there can offer really important clues. For example, bleeding in the back of the eye, the retina, or swollen blood vessels might suggest really high blood pressure. And sometimes they can see swelling of the optic nerve where it enters the eye. That's called papilledema. And that can be a sign of increased pressure inside the skull.
Wow, so just looking in the eye can hint at brain swelling.
Precisely. And even the heart rate can sometimes give clues about the brainstem. If the heart rate is abnormally slow, especially if the electrolytes turn out to be normal, that could suggest a problem, a lesion, in specific parts of the brainstem, like the midbrain or the pons or medulla.
Okay, so the history and the general physical give clues about the bigger picture, the systemic stuff. Now, how do they try to figure out where in the brain the problem might be? That neurological assessment must be key.
It absolutely is. It's a very focused but detailed neuro exam. And a major goal is often trying to tell the difference between a problem affecting the higher parts of the brain, the cerebrum or diencephalon, versus a problem down in the brainstem.
Why is that distinction so important?
Because generally speaking, the prognosis, the outlook, is considered more serious if the brainstem is involved. So they assess the level of consciousness and arousability, that stupor versus coma distinction we made earlier.
Right.
Then they look very carefully at the pupils, how they react to light. Are they the same size in both eyes? Do they constrict nicely when a bright light is shown? For instance, small pupils that still react to light might point towards a problem higher up in the cerebrum or diencephalon.
Okay.
But if the pupils are kind of fixed in the middle or dilated and they don't react to light at all, that's a major red flag. That often points to a severe problem, potentially in the midbrain or even lower down in the brainstem.
And there's that doll's eyes reflex too.
Yes, the oculocephalic reflex. If the neck seems stable, they might gently turn the head side to side. Normally, the eyes should kind of lag behind, momentarily moving opposite to the head turn.
Ah, okay.
If the eyes just passively follow the head, or worse, don't move at all, that strongly suggests something's wrong in the brainstem pathways that control eye movement.
And even the way the animal is breathing can offer clues. That seems incredible.
It really does highlight how interconnected everything is. Yes, specific abnormal breathing patterns can point towards different areas of brain injury. For example, there's something called Cheyne-Stokes breathing, where you see cycles of deep, rapid breaths followed by periods of no breathing at all. That often suggests severe, widespread damage higher up in the cerebrum or diencephalon.
Okay.
Constant rapid breathing, hyperventilation might point towards the midbrain, and then really irregular gasping types of breaths, sometimes called ataxic or apneustic breathing. Those are very worrying signs, often indicating damage in the lower brainstem, the pons or medulla, which control basic breathing.
Wow. So just how they're breathing tells you something about where the damage might be. Fascinating. What about cranial nerves? Can they tell anything just by looking at the face or eyes?
Absolutely. The
Yeah.
cranial nerves are super important because most of them come directly out of the brainstem. Cranial nerves I and II are a bit different, coming from higher up. So damage to specific cranial nerves often helps pinpoint the problem right to the brainstem. For instance, if cranial nerve 3, which controls pupil constriction and some eye movements, isn't working right, that often points to the midbrain. Problems with nerves V through 12, which control things like facial feeling, chewing, swallowing, tongue movement. Those usually suggest lesions lower down, in the pons or medulla.
And those really scary postures you sometimes see described, like where all the limbs are stiffly extended?
Yes, that classic rigid extension of all four limbs, often with the head and neck arched back. That's called decerebrate rigidity. And unfortunately, that posture typically indicates a very severe lesion affecting the midbrain. It's a very serious sign.
Okay. So we've defined stupor and coma, talked about the brain's role, the areas, cover the critical history and exam signs. Now, the overwhelming part, the sheer number of things that can actually cause these states, the sources list is huge.
It is extensive. And this really hits home why diagnosing the specific cause quickly is so tough, but so vital. They usually break them down into categories to make sense of it. First, you've got metabolic issues. Things like blood sugar getting dangerously low, hypoglycemia, or way too high, like in diabetic ketoacidosis. Severe imbalances in electrolytes like sodium or potassium. Or the buildup of toxins because the liver or kidneys aren't filtering the blood properly.
Right. Hepatic encephalopathy, uremic encephalopathy.
Exactly. These metabolic causes are actually pretty common, and the good news is they're often reversible if you can catch them and treat them aggressively.
That's good to know. Then toxins and drugs are another big category.
Huge, yeah. This could be accidental ingestion of, say, antifreeze ethylene glycol is incredibly toxic, lead poisoning, marijuana toxicity, which we see more of now,
Yeah.
accidental overdoses of medications, whether they're human meds left out or even pet prescriptions given incorrectly. Even things like xylitol found in sugar-free gum or baked goods.
So things found around the house or garage.
Definitely. Animals with unsupervised access are obviously at higher risk.
Okay. What about problems in the brain itself?
Right, the structural problems. So traumatic brain injury, getting hit by a car, a bad fall, primary brain tumor starting in the brain, or cancer that is spread to the brain from elsewhere. Strokes, which can be either ischemic where blood flow is blocked or hemorrhagic where there's bleeding, or conditions like hydrocephalus, water on the brain, where there's too much fluid buildup.
And infections or inflammation affecting the brain?
Yes, another important category.
Yep.
Things like viral infections. Canine distemper is a classic example. Bacterial meningitis. Fungal infections can get into the brain, certain parasites too. Or immune-mediated diseases, where the body's own immune system mistakenly attacks the brain tissue. GME, granulomatous meningoencephalomyelitis, is one vets see. And we shouldn't forget seizures. If an animal has prolonged, nonstop seizures, status epilepticus, they can often be stuporous or comatose for a period afterwards, the postictal phase.
And even systemic problems that aren't directly neurological initially.
Absolutely. Things like severe sepsis, that's an overwhelming body-wide infection, profound shock, where blood pressure plummets, or severe heat stroke. These can cause such widespread damage and lack of oxygen delivery that the brain suffers badly, leading to stupor or coma.
It's just such a long list. Does how it starts give any clues, like sudden versus gradual?
It can sometimes help narrow things down a bit, yeah.
Yeah.
A really acute, sudden onset might make you think more towards toxins, drugs, trauma, or maybe a stroke, whereas a slower, more progressive decline, especially if there aren't obvious signs in other body systems at first, might point more towards primary brain issues like inflammation or a growing tumor.
Okay. And diffuse signs versus specific signs.
Right. If the neurologic signs seem kind of vague and symmetrical, affecting the whole brain, that often suggests a metabolic or toxic problem. If you see very specific signs like weakness only on one side or particular cranial nerve deficits that might point more towards a focal lesion, a specific spot in the brain.
Okay, so with that massive list of possibilities, how does a vet realistically figure out the actual cause in what's clearly a crisis situation? What's their diagnostic game plan?
Well, sources lay out a very systematic approach, but it absolutely always begins with immediate assessment and emergency stabilization. That's non-negotiable. The absolute first priority is always airway, breathing, circulation, the ABCs. Making sure the animal has a clear airway, giving oxygen if they need it, supporting their blood pressure with intravenous fluids. Getting that 5E access established immediately is critical.
And checking body temperature and blood sugar seems like it's right up there at the start, too.
Critically important, yes. Because treating severe low body temperature, hypothermia, or high temperature hyperthermia, or a dangerously low blood sugar level can sometimes, almost miraculously, lead to a dramatic improvement in their mental state right away. These are common and very treatable causes you need to rule out or fix fast.
Okay, so stabilize first. ABCs, temp, glucose.
Right. And while that's happening, a quick focused neuroexam confirms the level of unresponsiveness, stupor, or coma, and checks those key things we talked about: pupils, basic reflexes, posture. Then the diagnostic workup really begins, hunting for the underlying cause. They'll run what's called a minimum database right away. This usually includes checking glucose again, looking at packed cell volume and total solids, PCVTS, to check for anemia or dehydration. Getting blood gases to see how well they're oxygenating and if their acid-base balance is off, checking electrolytes and measuring blood pressure. This is all screening for immediate life threats related to metabolism or circulation.
Then they move on to more detailed blood tests.
Exactly.
Yeah.
More comprehensive blood work and a urinalysis give a much broader picture of how the organs are doing. Detailed kidney values, liver enzymes, a complete blood count, CBC, to look for signs of infection or inflammation or more subtle anemia. Urinalysis is great too. It gives clues about kidney function, can pick up diabetes, and sometimes even show evidence of specific toxins, like the crystal seen with antifreeze poisoning.
Okay. And depending on what they suspect from the history and the initial findings, they might run more specific tests.
For sure. Like if they suspect liver failure is causing the brain signs, they might check blood ammonia levels. If there's any sign of bleeding, they'll run coagulation tests. Or they might send off specific tests for infectious diseases common in the area, or look for toxins like lead if the history suggests it.
And imaging is often needed, right, to look directly at the brain or other body parts.
Absolutely. They might start with x-rays of the chest and abdomen, looking for things like fluid in the lungs, signs of heart disease, maybe evidence of trauma elsewhere in the body. Skull x-rays might show an obvious fracture, but really to get a good look at the brain tissue itself, you usually need advanced imaging, and that requires the patient to be stable enough for anesthesia.
CT versus MRI.
Yeah. CT, or computed tomography, is generally faster and often used first in trauma cases. It's quite good at picking up fresh bleeding or skull fractures. But MRI, magnetic resonance imaging, is really considered the gold standard for looking at the soft tissues of the brain. It gives much better detail to see things like subtle tumors, areas of inflammation or swelling, strokes where blood flow is blocked, or that diffuse brain swelling, edema.
And what about taking a sample of the spinal fluid, CSF analysis?
Yes, collecting and analyzing cerebrospinal fluid, the fluid that bathes the brain and spinal cord, can be incredibly valuable. It helps diagnose inflammatory conditions, infections, sometimes even cancer cells within the central nervous system. However, and this is a really critical point the sources emphasize, you should only do a CSF tap after you've done advanced imaging like CT or MRI.
Why is that?
Because if there's already high pressure inside the skull, maybe from swelling or a mass, pulling fluid out from the spinal cord can actually cause the brain to shift downwards and herniate through the opening at the base of the skull, which is catastrophic.
Got it. Rule out the big pressure problem first with imaging? Makes sense. And then there are even more specialized tests sometimes.
Correct. Things like an EEG, an electroencephalogram, can look for seizure activity in the brain that might not be causing obvious convulsions. Or Bay-Ear testing, brainstem auditory evoked response, which checks the hearing pathway and helps assess brainstem function.
So the goal through this whole pretty intensive diagnostic process is to nail down that specific underlying cause, because the treatment really depends on that.
Entirely. It hinges on knowing what you're treating. And while all these diagnostics are going on, that emergency and supportive care is constant. It never stops.
Right. You have to keep the patient going while you figure out the why.
Exactly. Maintaining that clear airway, maybe needing oxygen therapy or even a ventilator.
Yeah.
Giving IV fluids carefully to support blood pressure and hydration without overloading them. Managing their body temperature. Providing nutrition, often through a feeding tube if they're unconscious for a while. And really importantly, preventing complications that happen just from being down and immobile, things like pressure sores or aspiration pneumonia if they accidentally inhale fluids or vomit. It's intensive nursing care.
And seizures, if they're happening, need to be stopped quickly.
Oh, absolutely. Ongoing seizures can cause more brain damage and make the stupor or coma worse.
Sure.
So getting those under control with anticonvulsant medications is critical. And if increased pressure inside the skull is suspected or confirmed, there are specific medical treatments vets use to try and reduce it. Things like elevating the patient's head slightly, using special IV fluids like mannitol or hypertonic saline that draw water out of the brain tissue. And in some cases, if the animal is on a ventilator, carefully controlling their breathing to lower carbon dioxide levels, which can also help reduce pressure temporarily.
Okay. Then once the underlying cause is finally identified through all that detective work, That's when the specific targeted treatment starts.
That's the goal. So if it was low blood sugar, you give IV dextrose. If it was a specific toxin, you might give an antidote if one exists, or use activated charcoal to try and absorb it from the gut. If it's an infection, you start the right antibiotics or antifungals. If it's an inflammatory brain disease like GME, you'd use immunosuppressive drugs. If it's organ failure, you treat that aggressively. And sometimes surgery might be needed for certain types of trauma, like removing a blood clot or maybe removing an accessible brain tumor.
The sources mention corticosteroids or steroids.
Yeah, they do note that steroids might be considered for some inflammatory conditions or maybe around tumors to reduce swelling, but they also highlight that they're controversial and generally not recommended anymore for traumatic brain injury, as they haven't shown benefit and might even be harmful in that specific situation.
Okay. And if it's liver failure causing the brain signs?
Right, hepatic encephalopathy. Treatment there often involves things like special low-protein diets and medications like lactulose, often given as an enema initially, to help trap toxins like ammonia in the gut so they don't get absorbed into the bloodstream and affect the brain.
So after all this, the stabilization, the diagnostics, the supportive care, the specific treatment, what's the expected outcome? What's the prognosis for an animal that's been in stupor or coma?
This is unfortunately where things get really variable. The prognosis depends hugely on several things. What was the actual underlying cause? How severe was the brain dysfunction to begin with? How long was the animal stuporous or comatose? And critically, how well did they respond to the treatment?
You mentioned some metabolic causes like low blood sugar might have a better outlook if caught quickly.
Generally, yes. Things like severe hypoglycemia or maybe some electrolyte problems, if they're identified fast and corrected properly, sometimes you can see a relatively quick and even complete recovery, which is fantastic when it happens.
But the more severe issue.
Yeah, conditions like severe traumatic brain injury or very aggressive brain tumors, or if an animal has been in a deep coma for a long time, those tend to carry a much poorer prognosis. And as we mentioned, problems directly affecting the brainstem generally have a worse outlook than problems confined to the higher parts of the brain. Even if they recover, there's always a chance of some lasting neurological problems, maybe blindness or balance issues, or persistent changes in behavior.
So it's often quite guarded.
Very much so. It really requires ongoing, honest communication between the veterinary team and the owner, setting realistic expectations.
Ultimately, what these sources really drive home again and again is just how critical rapid recognition is. Seeing that altered consciousness and getting immediate veterinary help.
Absolutely. The sooner that animal gets to the vet, the sooner that whole systematic diagnostic process can start, the faster the underlying cause might be found and treated. And all of that improves the odds, the chance of a better outcome.
Okay, wow. We have covered a tremendous amount of ground here. We started with that really frightening scenario of finding your pet unresponsive. We clarified the difference between stupor and coma. We delved into that crucial RRO system in the brainstem, detailed all the history and exam findings vets look for, explored that huge landscape of potential causes, walked through their systematic diagnostic roadmap, outlined the supportive and specific treatments, and finally talk about the prognosis, which is, well, complicated.
It really underscores that stupor and coma aren't just, being sleepy. They are serious medical emergencies, and they can stem from problems almost anywhere in the body, not just the brain. The vet really does have to be a top-notch medical detective in these situations, working fast but methodically.
And for you listening, while this is definitely dense and complex stuff, hopefully understanding the kinds of things vets are thinking about, from checking something simple like blood sugar or kidney function, to considering toxins, to needing advanced brain scans, hopefully, that helps you feel a little more prepared, or at least informed if you ever, God forbid, face this kind of crisis with your own pet.
Yeah, it highlights that urgency and why that detailed, systematic approach they take is so necessary.
In these cases, every single minute really does count, doesn't it?
It absolutely does.
Considering how many different body systems, the liver, the kidneys, blood sugar, electrolytes, heart, lungs, how all these things can potentially cause a pet to become completely unresponsive, well, it really makes you think about just how interconnected everything inside our furry friends truly is.
It's a powerful reminder, isn't it, of that intricate link between all the body systems and overall health.
It certainly is. Well, thank you for joining us on this deep dive into what is definitely a challenging but absolutely critical veterinary topic. Keep exploring, keep learning.
Thanks for listening.
And we'll catch you on the next one.